Thank you very much for giving me this opportunity to make the presentation on the safety for ultrasound operators. This presentation is also contributed by Professor Yihongzhou from Taiwan. COVID-19 in Wuhan. 42,000 medical staff from other provinces were assigned to Wuhan for supporting. None of them infected. Tongji Hospital is the largest hospital in Wuhan. 2,025 beds for severe and critical ill COVID-19 patients. Ultrasound is performed by different doctors in different countries. It may be performed by clinicians, radiologists, sonographer, sonologists. Therefore, it's difficult to make a unique agreement on the safety. The management of ultrasound room and safety should be adjusted according to the local epidemic situation. Ultrasound operators are at high risk of exposure because they work very closely to the patient. It's me, I worked in the ultrasound room in emergency department. During the pandemic, my hospital trained us on the safety using online training with presentation of video. It was very useful. It's also very important to reduce the use of ultrasound. Non-emergency department ultrasound examinations and ultrasound guided procedures should be cancelled or postponed to minimize the spread. In my hospital, we closed the outpatient department and changed to online consultation. We set up a fever clinic, closed the ultrasound department in the inpatient building, but we kept bedside ultrasound for non-COVID-19 patients. We set up ultrasound rooms in emergency department and fever clinic. Only bedside ultrasound is performed in isolation wards. My colleague was performing bedside ultrasound for COVID-19 patients. Used ultrasound equipments are not allowed to leave from fever clinic and isolation wards without terminal disinfection. Patient management. All the outpatient department and emergency department patients must undergo fever screening before ultrasound. For suspected or confirmed COVID-19 patients, ultrasound should be performed in fever clinic or isolation wards. Patients should wear a surgical mask. No visitors allowed in the room unless they are essential. Protective covers should be used for wireless transducers and normal transducers. If available, a small package of coupling agents with disinfection function can be used. Scanning should be performed with one hand on the transducer and with another hand on the keyboard. After the examination, the ultrasound probe and all contacted surface should be cleaned. During the pandemic, the trainees and students are not allowed to participate. If a medical staff has abnormal health condition, for example, fever, chest tightness, firstly, they should report it to department head and then report it to Department of Hospital Infection Management. At the meantime, they should be screened with blood test and CRP, CT, nucleic acid test. If COVID-19 was excluded, they should be observed at home or special place. If suspected or confirmed, they should be treated. Medical staff should strictly implement hand hygiene and use PPE correctly. Avoid dinner and chatting in group. It's recommended to have meals in a time shift manner. After working hours, they should mainly stay at home and try to avoid going out. Assessing the risk level of each situation, we should take the risk of the city and the country into consideration. When Wuhan was at high risk, the following assessment was used. Low risk areas include cleansing of each department, administrative department, logistic department. Moderate risk areas include emergency department, contaminated area of non-COVID inpatient department. High-risk areas include fever clinic, isolation wards. Layout requirements for fever clinic and isolation wards. We call it 3 areas, 2 entrances. 3 areas include contaminated area, potentially contaminated area, clean area, and there's also a buffer room between areas. 2 entrance, one entrance for patients and 1 entrance for doctors. The doctors should wear protective equipment in clean area, and after work they should take off PPE except upon mask cap in the first room. In the second room they take off upon masks caps, and in the third room they wear a new mask. Layout requirements for moderate risk areas. For example, emergency department, non-COVID inpatient department. It should also have 3 areas, 2 entrances, but there's no buffer room between areas. Here, doctors take off upon mask caps in clean area but near the wall. Then they wear a new mask. This is my department. We built a wall with a door between areas, and we can also simply put barricades between areas. We show the steps of taking PPE on the wall. The department should prepare sufficient PPE for doctors. There are 3 types of masks. The first one is disposable medical mask. It's not waterproof or bloodproof. Therefore, it's not recommended for the use during pandemic. The second one is surgical mask. It's waterproof and bloodproof, but the effective protection time is just 4 hours. For suspect confirmed COVID-19 patients, medical protective mask should be used. It includes 95 FFP2, FFP3, KN95, KF94. There are 3 levels of protections. First level protection is suitable for low-risk areas. The doctor has a cap, has a medical surgical mask, and have a disposable apron. When necessary, a glove and a gown should also be worn. Second level protection suitable for moderate and high risk areas. A cap inside. We wear 2 masks, 1 medical protective mask inside and 1 surgical mask outside. Goggles or protective screen. Isolation gown. 2 pairs of gloves and boot covers. Here's a video made by my colleagues. It shows how to put on and take off PPE. Third level protection. It's suitable for intraoperative ultrasound and interventional ultrasound. In addition to second level protection, a full-scale respiratory protection should be worn. My colleague performed the ultrasound-guided drainage of liver abscess for COVID-19 patients. Hand hygiene indications include before and after contacting the patients, before wearing protective equipment, before after removing protective equipment, before leaving the ward, before eating and drinking, before and after defecation, after returning to the resident room. There are 6 steps for hand hygiene, and the time should be at least 15 seconds. We usually use alcohol-based hand rub and sometimes use soap and water. We should know that wearing gloves does not mean washing your hands. The department should reasonably arrange the work of medical staff to avoid overwork, and also try to avoid arranging the elder staff to the highest risk areas. Thank you very much for your attention.